Hello, and thanks for joining us. We felt that it would be appropriate to do a Facebook Live with Dr. Ruthie Kreider. Dr. Kreider is a local mom here in town and two wonderful boys and lives here in our community. But more importantly, she is one of the critical team members as a physician in our emergency department at East Georgia Regional Medical Center. There's a lot going on. There's a lot of rumors going on. When we start closing schools, we start closing businesses, we start calling off events. And, churches now are beginning to cancel services, which we think is probably a prudent thing to do at this point. So there's a lot of messaging going out. We're under a state of emergency from the president now and a state of emergency from the state of Georgia. And our local emergency managers are doing things too. And we're going to see more things kind of ramp up. So there's just a lot of concern. There's a lot of rumors, on social media of this person have it and that person having it. And I think that, the bottom line is, I want to be clear, at this recording, there is no official word no validation, I should say, of anyone in our community having the virus at this point. But I think we are operating under the suspicion or the suspect that possibly there have been people in our community that, one, either have the virus already, or two, have come in contact with people who have the virus. Regardless, even if you have the virus, there's just certain things that you can know and certain limitations. So I just thought it'd be great to have Dr. Kreider come in today and talk with us. Thank you so much, Dr. Kreider.
Yeah, thanks, Dwayne. I appreciate you having me.
I'd like to talk about this from a mom's perspective.
Okay.
So if your child or your husband has come in contact, have been at a social event within the last week, that we know someone at that event now has tested positive, even if they don't live in our community, if they just come in contact with that, or maybe some salesman that calls on you at your work that you found out now that was, or an event that you were at this past week, you found out that they have now tested positive. What should you do?
Well, I would definitely use an abundance of caution. At this point, if you have been in contact with someone that you know has tested positive, you may want to monitor your symptoms. I would use the utmost of caution and try to prevent any further spread. There is going to be a lag of symptoms from the time you contract the virus until the time you're symptomatic. So are you contagious during that time? Yes, but your risk of spreading it is low. In other words, you're not having coughing or sneezing, so you're not able to spread it as much as someone who is symptomatic. I would definitely use social distancing. I would consider doing quarantine. I would limit interactions between my child and any other children, and really monitor my symptoms. Might touch base with my healthcare provider as well, my primary care doctor, to let them know and also get their recommendations.
So we're in the middle of flu season, and people compare this a lot to flu, and there are some similarities of flu. Mm-hmm. But let's say that I get sick tonight, and I spike 103-degree fever. I start having nasal congestions. I have symptoms that could be this. When should I go to the ER? When should I call my doctor?
So for mild symptoms that doesn't involve severe shortness of breath, I would stay at home and use the telephone and contact a local resource such as your primary care doctor. I would not go to the emergency room. Really, we want to limit the emergency room for more moderate to severe cases where you're experiencing some severe shortness of breath and may need to get extra support. Our medical resources are finite. They're limited. And I say that in general, although we're prepared and we have a wonderful team of doctors, nurses, ER personnel, paramedics, we are a limited resource in this community and in the nation. And so we want to be able to treat some of these symptoms at home, especially mild symptoms. So no reason to rush to the emergency room, even if you suspect that you may have coronavirus.
So you were saying that even in cases that have tested positive, that they're still sending those patients. I'm stressing, we've not had any in your ER, but in physicians you've talked to throughout the country that have diagnosed positive cases, the protocol at this point is to send them home for self-quarantine. So, and treat at home, because there's no treatment. You're really, there's nothing you can do in a mild case or that you cannot do for flu or other things through a local pharmacy, and that's treat the symptoms, as you said.
Correct. That is absolutely correct. Patients that we physicians are strongly suspecting to have coronavirus that are being tested, we are sending those patients home for self-quarantine. There's no way to keep patients with mild symptoms at the hospital. So yes, that is absolutely accurate.
So when do I get concerned? When should I maybe decide it's time for me to go to the ER?
Yes, if you suspect that you have coronavirus and your symptoms are getting much worse, maybe you're coughing more, you're breathing faster, you're feeling extremely short of breath, that's the time to go to the emergency room. Also, if you have a lot of other illnesses, if you have kidney disease, if you have diabetes, if you have cardiovascular disease, those are diseases that put you at higher risk, and so you need to be more concerned at that point as well.
So distress, respiratory distress or some sort of distress, not just 103-degree fever, not just nausea,
Correct.
not just those symptomatic things. So I want to stress what Dr. Kreider has said. Even if you are tested positive, you're still going to go home.
Yes.
Unless you are in some sort of severe distress.
Correct.
So the other, and that gets to the point about testing. We've heard so much about testing, and we know testing is very limited. So if you were at a gathering and you know there were another 100 people at this gathering and one person had it, the first inclination I would think people was this: I want to go get tested. Well, it's not possible, right? To
Correct.
have we're only testing at around 100 per day statewide right now. We're trying to they're trying to ramp those up. So what would be a scenario where you would test?
A scenario where I would test is if I had a significant exposure and someone who had a high fever and that was also symptomatic with shortness of breath. I would, follow our protocol, and they would be considered someone that might need to be tested.
So that's a narrow window, basically.
Yes, and we do not have any commercial kits available right now. We're hoping that will change, but there's no way for us to test a mass number of people. I mean, the testing is on a very limited basis now.
So that's the reason, and I know it's difficult to understand, but that's the reason we've stepped up all of this.
Yes.
Because we feel like, and the experts, the epidemiologists, the scientists are tracking the model of Italy, and you've heard a lot about that model, but we apparently, our first case is very similar to their first cases, and they're a little ahead of us, I believe, and they're anticipating that if we are affected like that, based upon those models, and there's a lot of different variations out there, they're anticipating the next 2 weeks could be the most critical for us. Is that kind of where we're at right now?
Yes. I mean, I definitely think, we have the advantage of having a little bit more time to prepare for this situation and get ahead of it. We're seeing some very bad consequences that are happening in Italy. They have finite medical resources just like we have, and so we don't want to end up in that same situation. We want to be able to prepare. An ounce of prevention is worth a pound of cure, and so we certainly want to try to avoid those scenarios. And I think there is some feeling that there's an overreaction on the part of the schools, the churches, some of these closings, the closings of gatherings, but I absolutely support the decisions of our leaders in this area to close these venues, to limit social interaction. I think that is going to be very important for the health of our community, protecting our families and protecting our elderly that we care so much about, and we want to keep them safe and out of harm's way. So
the statistics prove that a large percentage of us, even if we contract it, we're going to be okay.
Yes.
It'll be a rough few days, but we'll survive it. Where the numbers are really dangerous are for the over 60 population, really 70s and 80s. And, we are a community that we have a large population of senior adults, my parents included, yours also. Yes. And so we want to protect them, and I think that's where the concern is. So if we can prevent them from getting it, then the survival rates obviously is going to be
Yes.
better. But people compare this to flu. But that's where it's very different, correct?
Yes, I mean, we're seeing a higher percentage rate in deaths in the elderly. I mean, flu can be devastating to the elderly as well, but really this new coronavirus, there's no treatment besides symptomatic treatment and supportive care for those most in need. And so trying to prevent the spread is critical. And especially in these elderly populations, a lot of our elderly have other comorbidities such as diabetes or cardiovascular disease, so they're even more at risk. So really limiting the spread, washing your hands, using precaution, coughing into a Kleenex or coughing into your elbow or sneezing, washing your hands, disposing of any Kleenex, and limiting that spread. Also, I'd like to encourage people to limit interaction with the elderly if you have any symptoms at all. You know, now we live in a society where we can FaceTime. I'm not saying don't contact your family members, but consider other ways to interact with them and connect with them through your phone or through FaceTime. I think that'll be a great way to let them know that you love them and that you care, and to check on them without potentially exposing them unnecessarily.
I know that's a good point. We are working through Bullock VOAD, through the ministerial associations, local churches, and civic and nonprofit organizations to develop a list of people who are interested in volunteering. We'll share that hopefully later today, where there'll be two options on that list: people who are over 65 that may not have family, that want to have somebody contact them. Of course, we would guarantee them a phone call at the very least per day. We're not going to go visit them, but we're going to call them once a day. And if they need things from their pharmacy, or if they need some groceries, we're going to do things to try to get that to them so they won't have to leave the house. So we're working on putting together volunteers. We've got groups working on that, identifying people who may have those needs, and then volunteers to do that. Social spacing.
Yes.
I'm a
Yes.
small business owner.
Yes.
You're a small business owner.
Yes.
What? Let's talk about that. I mean, should we lock ourselves in our house?
No. I mean, really, the appropriate social spacing as recommended by the CDC is 6 feet. I strongly encourage people to stop shaking hands. You know, I love giving people a hug when I meet them, or giving them a really strong handshake. But in the last few days, I have not offered my hand in a handshake, and it's been very appropriate. I think everybody is concerned, everybody understands, everyone's heard of the social spacing. I strongly encourage everyone just to smile and nod, and even if you just almost do a little fake handshake, I definitely think everybody's on board, and that can very much help limit spread. So please, let's quit shaking hands, and we can use other friendly ways to know people how glad we are to see them and meet them and greet them. And obviously that it may be difficult at times to keep 6 feet away, just like how you and are now. It's sort of an awkward amount of space, but I think as we practice it and put it into place, it'll get easier.
I want to just talk about from a VOAD perspective now, where I'm putting that hat on. We talk about preparation for hurricanes and how we prepare our community. Our community obviously went through Matthew when we were not as prepared as we should have been. Since then, we've probably been over-prepared, if that's possible. And I just want to say a word to the leaders of our churches, to our governor, even our president, and Ted Wynn, our public safety director. A lot of these people are making very difficult decisions.
Yes.
It's very, very difficult for them to start calling off St. Patrick's Day and the Masters and these large sporting events. But that's the seriousness of this situation right now. Not to scare folks, but if we do the right things, we're prepared and we'll get through this. And hopefully, just like watching that hurricane on TV, that's where we're at right now. We're kind of watching this. We know it's bad in other areas. Is it going to hit us? Is it going to be bad for us? We're going to get hit. We feel like everybody will at this point. There are indicators already showing that there are cases, people in our community have been exposed. and there's probably a lot we don't know. So we're having to operate under the assumption that we are going to be affected by this. But the decisions we make over the next 2 weeks is going to directly depend on how severe it is and how rapidly it spreads. And I also want to go back to the flu part about this, because there's a lot of comparisons. This is spreading so much faster, right, than the flu. And I think that's a big concern. It's in all 50 states now, I think the cases have been reported.
Yes, it seems to be extremely contagious.
Yes.
So that is highly concerning that it is so contagious and that we are seeing the spread really around the world and throughout the states. And I'm sure there are many undiagnosed cases as well. I love your analogy about the hurricane. We want to be over prepared. I hope that that's the case, but we're really in uncharted territory. And I want to stress to everyone, just like when we're watching a hurricane, how things can change day to day, that is going to be what will happen with coronavirus and COVID-19 as well, is that things will change. Information is going to change. So expect that. So if one day you hear one thing about the coronavirus and then the next day there are more measures or more actions in place, please support our leadership. Like you said, they're making very, very difficult decisions, and just know that their information is changing as they relay it to us. And so just like a hurricane, as things change, we modify our behavior.
It's a fine line from a media perspective and from a leadership perspective and from a physician's perspective. We don't want to scare you. We don't want to create the skies falling scenario, but we also have to look at data, and we have to look at the things that concern us and make the decisions and communicate those decisions in a way that we're all responsible. So just kind of the recap as we close here. If you're symptomatic, even if you've been diagnosed with this, we don't have the test kits to diagnose, so don't go running to the ER, to health department, trying to get tested. Even if you've been in a room that you know somebody has had it, what you need to do is just pull back, maybe not get into social environments, social spacing, and treat your symptoms. And only when it becomes, if you think you've got it, call your doctor's office. Don't go showing up at the ER, and only present yourself at the ER for anything, not just this, but any illness. If it's severe, if you really think it's life-threatening, because the biggest thing we can do, I asked Dr. Kreider, what can we as a community do for healthcare workers, and what was your response?
Keep yourself healthy.
Yeah. Because if we're healthy, if we just comply to some of this, that keeps us out of your ER, and that frees up beds, that frees up resources for you to treat the most critical of the people that need to treat.
And being healthy is going to involve social spacing, washing our hands, when we cough or sneeze, trying to protect that, and really just being very respectful of our elderly patients, our elderly relatives, trying to care for them and continue to connect with them, but in ways that hopefully limits any virus exposure as well.
We'll be continuing dialogue with Dr. Kreider as this progresses throughout the week and the days that come. We felt like, for Grice Connect and our perspective in Bullock VOAD, rather than to keep knocking down rumors on social media, and some are true, some are not, is let's just take a breath, let's step back, and let's see as a community what we need to do and how we go forward with this. And together, this is an amazing community.
Yes.
We always rise to everything. And this is a great opportunity for our community to shine in incredible ways. We're very spiritual, we're very giving, we're very loving. And, I'm equally getting this number of calls and private messages about how can I help? And I think that's wonderful. So that's why we're creating databases for opportunities, because unlike a hurricane, I won't be making a call that we need people to show up to bag food, because we don't want 1,000 people showing up in spaces. So we're going to be more delicate about assigning needs and responsibilities as this thing develops, but there will be opportunities for us to serve our friends and neighbors. And just have that neighborly approach, just love on somebody. And everybody takes this differently. There are some people that believe that we're overreacting, and there's some people who believe we're underreacting, but everybody digests this differently, and be respectful of that, and know that some people may have high anxiety. This is really tough on them, and there may be people having financial struggles. You're being out of work potentially, kids out of school. That just creates a lot of different scenarios for everyone. So as a community, from a community perspective, I think the biggest message for your church, your business, your organization right now is to have a heart and be as compassionate and as understanding and reassuring as we possibly can, and support everyone, not just our healthcare workers, but everyone in our community that's going to be affected by this.